I understand that there's going to be a certification sort of process with ultrasound and physiotherapy that's just coming down the pipe, and the course that I took was sort of the certification course that they're planning to do. So you look at the safety issues of ultrasound, you look at the applications, and then how to use it properly when you're looking at the bladder, all the things you need to know about pressure, and then how the Doppler works. The course was excellent, and I'd just come and practice, and try and look at the same thing on different people to see how people differ, how structure differs a little bit. If I've got a patient that I think really needs it, it's going to be incredibly beneficial to them, then I'll say, yeah, I'll suggest it. There's been many times when I've just been working on someone, and I'm trying just manually to get them to engage the muscle, and it's like, okay, can't get it. There's nothing I can tell you to get this, come on. So I'll pull them back in here and spend 5 minutes and just want to make sure that we're thorough. So the deepest muscle in the abdominal wall is the transversus abdominis, and it's basically your core muscle. On the ultrasound machine, we're looking at how that muscle reacts to the commands of how to try to find it. Because it's a deep muscle, and because that whole muscular system was embedded from when you started to crawl to stand, that system went into your subconscious, and it's not an easy muscle to pluck out of your mind and go, oh yeah, okay, I know how to contract that. Not like a bicep or a quadricep, you visualize it, you can see it. It's so deep in there and linked into a subconscious mechanism called your motor program. So if you can actually get the patient to visualize the muscle and see how it works, it's like a biofeedback. So then they gain control over it, they know what it's supposed to feel like when it's contracted, and then they get the right idea. So you get that core retraining, because you can't strengthen a muscle that your brain can't find. So it's a really great way to see if it's working, if it's firing at all, what it looks like in there. Is it atrophied? Is it fibrofatty? Is it, what's going on with the muscle? And then to see the ratio of that muscle to the other muscles that might be too dominant. So then you have to break those down too and get those to relax while the transversus gets stronger. We also look at the pelvic floor to make sure the pelvic floor is firing properly, and then we'll put the patient over on their stomach and have a look at the muscles of the erector spinae group, and again look at if they're atrophying, if they're firing in proper sequence, because there's a sequential order that they should be firing in, and then we watch how that happens under load, and then we keep increasing the load to see if they can maintain stability in the spine before the power muscles kick in, and it's pretty important, for a spine to be healthy. Depending on the time of year, we see a lot of skiing, snowboarding related injuries. In the summertime, it's really busy with mountain bike injuries because the Whistler Blackcomb Mountain Bike Park is pretty popular. We've got a lot of baseball injuries, and now road biking is becoming very popular, so there's injuries related to that. It's a very busy